Hi all. Today we are going to see about mental status examination. Okay, what is mental status examination? The mental status examination is a systematic way of evaluating a person's current mental function. Okay, it helps the clinician understand how well the person is functioning right now, rather than focus only on past history. The mental status examination is about the current status of an individual. Okay, how they were in the present. Okay, it won't bother about the past, but still we'll be collecting the details of the past of an individual. Okay, purpose. What is the purpose of doing the mental status examination? Yes, to assess current strengths, weakness, and dysfunctions. Okay. The purpose, the first purpose of the mental status examination is to assess the current, what are the weakness they are having, what are the dysfunctions, like what they are was not able to do currently, and what is their weakness as of now. So all these will be uh, observed through the mental status examination. Okay, to improve diagnostic accuracy. Diagnostic accuracy is if an individual is going to a clinical psychologist, if they are having any symptoms that is related to the clinical psychology, like it can be of schizophrenia, it can be of OCD. So to confirm that, they'll be using the mental status examination. Okay, but only through the mental status examination we can say that the individual is having any schizophrenia or anything else. Okay, and it differs. Yes, especially important for new patients. If a patient is coming to a hospital as a new, so the mental status examination will be examined by the psychologist. Okay, which will help them to gather some information about the people's past and the present history. Mainly it is used to collect their present history, like their current strength, weakness, and their dysfunctions in any particular area. Okay, the next is how MSc is conducted, how this will be conducted. Usually done during a clinical interview. Okay, yes, usually done during a clinical interview. It is not rigid or formally structured test. Yes, the MSc is conducted is conducted during a clinical interview. You won't be giving any set of questionnaires or any assessment to them. We'll just observe them and will mark the metastasis examination. We'll be having some certain statements and that. Okay. The clinician observes the patient's behavior. Yes, the psychologist will silently observe the patient's behavior. Okay, how they are appearing, their mood, and everything will be observed by the clinical psychologist there. Okay, engage the patients in casual conversation. Like they will ask basic things like what is the time, what is the date, what food they have, which from which place they are coming from, who they are. So all these information will be gathered by the clinical psychologist during this clinical interview. Okay, explores area like content, thought, mood, perception, judgment, and insight. Okay, through the mental status examination we can explore the areas like thought, content, mood, perception, how they are perceiving, how they are judging. Okay, all these will be explored through the mental status examination. Yes. Yes, what are the key features of the patient's behavior? Okay, appearance. Okay, if an clinical psychologist is observing a patient, first they will see the appearance, like how they have groomed, how well they are dressed, how much they are hygiene. Okay, next is their consciousness as or alertness, that is whether they are awake or drowsy, they are feeling sleepy or confused, whatever it is. Okay, and psychomotor behavior, like abnormal movements. Okay, difficulty in concentrating or depression, speech, their rate, volume, coherence, pitch tone, all this will be noted. Thought patterns, logical and disorganized thinking. Okay, orientation, awareness of time, place, whether they are aware of the current time, place, and way there. Okay, memory, whether they can see the present long-term memory, whether they can recall the memory of the recent events, and affect or mood, emotional expressions and feeling and state. Energy, what is the level of activity they have. Perception, how they are perceiving a particular object or an event. Okay, and judgment, decision making, and their problem solving skills, all these matters. Yes. Okay, So all these appearance, consciousness, alertness, psychomotor behavior, attention and concentration, a speech, their pitch, tone, all volume, all these will be noted. And thought patterns, okay, logical or disorganized, whether their thinking pattern is logical or disorganized. Next, orientation, whether they are aware of their okay, and judgment, okay, all these will be noted by the clinical psychologist while taking the MSc. Okay. Uh, yes. Yes. Thank you.